Dear ANA community, what do you mean by Yukti? How to understand Yukti Pramana or Yukti Pariksha as per the ancient understanding? How to understand Yukti Pramana or Yukti Pariksha as per the current conventional understanding? How to understand the Yukti Pramana as the Ayurveda clinician? These are the questions that will be answered in this particular video. Dear ANA community, put a thumbs up and press the bell icon so that the YouTube algorithms will fetch you the right information at the right time for the right purpose. Yukti Pariksha, it is the specific description mentioned in Charaka Samhita. In Sutrasthana 11th chapter, it is being mentioned. That is, Buddhi Pashyati Ya Bhavan Bahukarana Yogajan Yuktistrikala Sadhyaya Trivargaha Sadhyate Yaya. So that is the buddhi or intellect which will be seeing the multiple informations. So that is visualizing the informations, what we can say, visualizing the hearing information. That is what is considered to be yukti. Bahukarana yogajan. In the sense it is able to connect the multiple informations. In other words, the Ayurveda principles can be understood with the principles of physics, chemistry, and biology. Principles of Roga Nidana that can be understood with the principles of conventional Western physiology or pathophysiology. In that way, so that is Bahukarana Yugajan, that is he can able to link the multiple informations so that the concrete knowledge or depth knowledge, in-depth knowledge that will be attained by an individual. And so that is, it is being mentioned Trikala and Trivarga. There are two terms are being mentioned. The term Trikala refers to the person who is having the yukti. They will be having the past knowledge, present knowledge, and accurate future knowledge. So that means they can able to predict or link the informations from past to present to future. So that is Trikala as such. Whereas Trivarga, here the term Trivarga refers to Dharma, Artha and Kama. So these are the Purushartha Chatushtaya. Among them, Trivarga, that is Dharma, Artha and Kama. In this particular example, we are going to look into the yukti of a student and a physician. Of course, whenever we think about it, the agriculturist. So regarding the Trikala Jnana, how we are going to say that? So by saying the coming the rain, they are going to think about the, what do you say that? The regarding their previous knowledge of their crops formation, etc. That can be said there. And present knowledge, they are going to plow the field, etc. And future as such, so that is they are going to predict the possible crops grown properly. So that will be considered to be the future knowledge that can be attained as such. That is Trikala Jnana as such. And Trivargaha, so that is Dharma. So in the sense, so agriculturist, what is his Dharma? They are going to grow the crops as such. By that, they are going to get the Artha, that is the desired, either the things as such they are going to attain, and Kama, so that is they are going to have their own desired items as such. So that is Dharma, Artha, Kama as such that can be attained by this particular aspect in terms of the agriculturist. And when you think about the yukti as such that is being mentioned, that is connecting the different informations. So that is the, as we have discussed earlier, for an Ayurveda student studying in second year, in that they are going to learn about the Roga Nidana. But in their first year, they are going to learn about the Kaya Chikitsa. Sorry, Kriya Sharira. And in their third year, they are going to learn about the Kaya Chikitsa. So that is if they are having the depth knowledge, in-depth knowledge, etc., they are going to connect Kriya Sharira, Roga Nidana, and Kaya Chikitsa in a beautiful, understandable way with deep understanding. So this is possible if the person is having the proper yukti as such. And when you think about the example in relation to Bahu Karanatva, so here, so that is the example here is being given, that is the three different Nidana. That is, the person is undergoing Virechana and the person is doing Vyayama. And third thing, the person is exposed to Atapa Sevana. When you think in that particular angle, when the person is going for the Virechana purpose, so this is responsible for the Langhana, that is lightness of the body, specifically seen initially in the alimentary canal. And when you think about the person is doing Vyayama, so Langhana effect that can be seen in the adipose tissues. If the person is doing excess amount of the Vyayama, so that will be responsible for the conversion of the stored fat into circulating fat. Thereby the lightness of the body can be attained. And when you think about the Atapa Sevana, so that is the exposure to sunlight, so this is responsible for the Langhana effect that will be observed in the body fluids in the form of excessive sweating as such. Thereby the person will be having the reduced intravascular compartment later. When you think about all the three different ways Nidana, wherein the one particular Nidana is specifically seen in the alimentary canal, so that is Virechana, whereas the Vyayama, wherein the effect will be observed in the intracellular compartment, interstitial compartment, and intravascular compartment in relation to the adipose tissues as such. So there we are going to observe the Langhana effect there, and Atapa Sevana, that is excessive sunlight exposure. This particular lightness of the body specifically will be observed in case of the intravascular compartment. But altogether, we can able to see the Laghu Guna Vriddhi. So that is here a person who is having the appropriate yukti, they can able to visualize the Laghu Guna Vriddhi in different parts of the body as such, though the persons are exposed to multiple etiological factors. As far as the Yukti Pariksha from the text, it is being mentioned regarding the examples. Jalakarshana bija artu samsarga samsya sambhavah. Jalakarshana bija rutu sanyogat sasya sambhavah. Yuktihi shadhatu sanyogat garbhanam sambhavastatha. Madhya manthana manthana sanyogat agni sambhavah. Yuktiyukta Chatushpada Sanpad Vyadhi Nibarhani. So that is the combination of proper combination of water flowing of the field or earth or land, then planting the seed, and the two planting the seed in the right season. So these are the combinations that are required for the best plant to be generated or produced. When you think about the Pancha Mahabhuta and Atma, the proper combination of these 6 factors, so that are responsible for the formation of Garbha. The wood, churner, and churning properly, so that may create the spark. Thereby the person will be having the fire later. So this is what is considered to be the examples that were given from the text for Yukti Pariksha. And fourth aspect, that is Yukti Yukta Chatushpad Sampad Vyadhi Nibarhani. If the person is considered to be, the physician is intelligent, and if the medicines are of good potency, high potency, and if the attender or the person who is giving the or assisting the physician, he is having the proper intellect as such, and the patient who are receiving the treatment, patients who are receiving the treatment, if they are having the appropriate memory power, etc., then we are going to get the remission of the symptoms in the diseased individual. So this is what is considered to be the Yukti Pariksha examples given in the textbook. Then, regarding Yukti Pariksha for a student, you are studying in the second professional, and the important term that we are going to learn in the second year, that is Roga Marga. If you are able to learn or catch the information related to Roga Marga, then that may indicate you are having the appropriate knowledge of Srotas in your first year. This is the previous knowledge as such. That is what is considered past knowledge. Whereas if the Roga Marga, if you are knowing each and every corner or concept of Roga Marga, then they are in a better position to understand the Dosha Gamana. So that is Dosha Gamana from Koshtha to Shakha, and Dosha Gamana from the Shakha to Koshtha, or Dosha Gamana from the Marmasti Sandhi to the Koshtha. They are going to understand these informations in their third professional year. So that is what is considered to be in terms of the Trikala Jnana, if you are talking about. Whereas if you are talking about the Trivarga, so that means if they are knowing the concept of Roga Marga very well, then they can able to understand each and every concept of the Nidana, Lakshana, Samprapti analysis. They can able to link those informations accurately, so that they can able to get the accurate results itself. That's how the dharma of the Ayurveda learner can be achieved. And if they are knowing about the knowledge properly, they know what they have to do or they should not do, etc., then artha will be followed. So that means they can able to generate multiple sources of income, either in preparing the medicine such as avaleha, etc., or the spreading the right knowledge. Maybe nowadays the online education is one of the most important way of spreading the right information. They can able to spread the information accurately and kama. So that means they can able to achieve their passion if they are doing their activities. So that is in this particular occasion, as a student, they are learning the informations of Roga Nidana based on one's mission and vision. They can able to achieve their passion itself. For example, they can able to link the information of Adhyashana, Ama formation, and Prasadhatugata Ama and Amavata, etc. In that way, they can able to link those informations in the proper understandable manner. Then example of Yukti Pariksha in the, what do you say that in the case of clinicians. So here is an example of the patient who is having the ascites. So that is the ascites refers to the accumulation of the fluid, excess amount of the fluid in the peritoneal cavity. When you think about it, this is the present scenario. And when you think about the past knowledge, so that is if he is giving the history of alcoholism, then or otherwise he may give you the history of liver dysfunction, such as the yellowish discoloration of the skin, sclera, etc. Then connecting those informations and predicting the future as such, that is very easy. For example, if the person is coming to you with the history of alcoholism, liver dysfunction, etc., and he is having the ascites manifestation, then we are going to predict in future the person may develop hematemesis and bleeding per rectum. So this is attributable to the alcoholic liver disease, that is cirrhosis of liver may be the possibility there. So that is the possible diagnosis we are going to think about. That is the connecting the past, present and future. So here, what is the dharma here? So dharma is the physician, they can able to make the diagnosis accurately, but very fastly they can able to make the diagnosis. Artha. So that is if they are going to give the accurate treatment, naturally the newer and newer patients they are approaching this particular physician. In that way they can able to gain certain amount of the wealth also. Kama. So that is they are going to get the right name and fame also. In that way the Trivarga can be attained by the intelligent Vaidya as such. In this particular example, let us look into the second example. So here the person is doing the coughing, and so that is he is having the little bit amount of the sputum also. So this is the present knowledge, and past knowledge he is saying history of dust or smoke exposure. So when you look into the past knowledge and present knowledge, the prediction in future maybe he may develop bronchial asthma. Maybe possibly they can able to apply that in terms of the Trikala Jnana. So as far as Trivarga in the sense, as we have discussed earlier in terms of what you say that the alcoholic liver diseases etc. Here also we can apply here. That means dharma in the sense it may be the person will be skilled or Vaidya will be skilled in making the diagnosis of Pranavasruto Vikara. And if they are able to make the diagnosis accurately, naturally the wealth to that particular Vaidya that will ensue as rapidly as possible. And the Kama, they can able to have the, what do you say, that they good name and fame can be attained. Example of another here, so that is if the person is presented to you with a history of abdominal pain and vomiting, and the present knowledge is hyperacidity may be diagnosed. The reason is the lady is giving the history of consumption of spicy substances frequently, such as the achar or samosa etc. frequently she is being consuming, and the future as such based on the past and present knowledge you can able to make the future knowledge, that is development of gastric ulcer or gastric perforation can be made out. In this way, so Yukti Pariksha can be applied in terms of what you say that the different examples as such. To sum up, Buddhi Pashyatya Bhavan Bahukarana Yogajan Yuktistrigala Sadhyaya Trivargah Sadhyateya. So the intelligent person's intellect that will see the invisible things also. That is, that can visualize the said information. Bahukarana Yogajan, that can able to connect multiple sources of information. And Yuktihi Trikala, that means the person will be having the three types of the knowledge: past knowledge, present knowledge and future knowledge. They can able to connect those three different types of the knowledges itself. Thereby, the person who is having the appropriate intellect, they can able to achieve dharma, artha and kama. This is how the knowledge of Yukti Pramana, Yukti Pariksha can be understood. Dear ANA community, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread the information to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Dear community members, press the like button and press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.